Hi, I'm Ashley from Steppin' Up Physical Therapy, and I'm here to talk about temporal mandibular joint dysfunction, or TMD. TMD is pain in the jaw that stems from the temporal mandibular joint, or TMJ. The TMJ is located here, just in front of your ear, and you can feel it moving when you open and close your jaw. So if you're talking or eating, you can feel that joint moving. If you have TMD, you most likely have pain around that joint area, but you could also have pain that travels down into your jaw. It could travel into your face, down into your neck, sometimes even into your ear or even into your head. If you have TMD, you could have pain at rest, but most likely you'll have pain when you're actually moving your jaw, so opening your mouth wide to take a big bite of food, or even when you're yawning. You might notice that you can't open your mouth as wide as you usually can. And then sometimes you'll even have some trouble chewing food, talking. All of those types of things are usually painful. There could be some clicking, popping, catching, even some locking in that joint area, but that's not always the case. And in fact, if you just have clicking or popping, that's not TMD in and of itself. You have to have that pain and difficulty using your jaw for it to actually be TMD. So we don't always know why TMD begins. It could be an injury to the area. So if you're involved in a sporting activity and you take a direct blow to the face or the jaw, that could definitely start TMD. But it's not always something so obvious. It could be arthritis. So we're talking about a joint. So just like every other joint in your body, you can develop arthritis in that area. So arthritis is wear and tear on the joint. And if you think about how much you use your jaw throughout the day with eating and talking, that's definitely an area that you could develop some wear and tear. And then something even less obvious that you wouldn't think of would just be sitting with poor posture throughout the day. So a lot of us sit with poor posture, especially nowadays when we're using our cell phone for long periods of time. If you're using your cell phone, a lot of times you're holding it in front of you, you're kind of slouched forward looking down at it. And what happens is when you're in that position, it puts your joints and your muscles in a different position than what we consider normal. So when you're in that slumped, slouched posture and your joints are in a different position than normal, the mechanics actually change. So then your joints and your muscles are working differently than they're intended to. And so then that can cause some abnormal stress and strain on the joint and the muscles, causing them to become painful and creating that pain that you're feeling into your jaw. So if you have pain in your jaw and you think that it could be TMD, what can you do about it? A lot of people don't realize that physical therapy can be helpful. So as physical therapists, we specialize in working on muscles and joints. And as we've talked about, that TMD develops from the TMJ, the joint, and the muscles around that area. So those are definitely areas that we can work on as physical therapists. And with physical therapy, we do some specialized exercises and stretches. We also do massage work and trigger point dry needling to help with the pain that you're having. But there are some things that you can try at home first to see if you're able to maybe manage your symptoms on your own. So attached to the website where you clicked on the link for this video, we have also attached some home exercise programs, and we've developed one specifically for TMD. So you can print those exercises out, give them a try at home, see if you're able to manage your symptoms on your own. But if not, if you feel like you need to come into the clinic and see one of our therapists so we can evaluate you one-on-one to take a look at your individual needs and your individual symptoms, then give us a call. We can schedule an appointment for an evaluation. Our number is 260-497-7191. We hope to hear from you soon.